Everything you need to know about vitamin A. Vitamin A is an essential vitamin that the body needs for growth and development. It is also vital for cell recognition, vision, immune function, and reproduction. It also helps the heart, lungs, kidneys, and other organs function correctly. Vitamin A deficiency is rare in the United States. If it happens, it can lead to eye problems, including night blindness. In this video, we'll learn more about the types of vitamin A, what vitamin A does, and some good source of it. Types. Vitamin A occurs in different forms. Preformed vitamin A can be found in meat, fish, and dairy products. Provitamin A is present in fruits, vegetables, and other plant-based products. Retinol is the main active form of vitamin A in the blood. Retinol palmitate is the storage form of the vitamin. Beta-carotene is a provitamin or a precursor of vitamin A that occurs in plants, especially dark-colored fruits and vegetables and oily fruits. Beta-carotene is in itself an antioxidant, but the body can also convert it into vitamin A as needed. Benefits of vitamin A. Vitamin A contributes to various bodily functions and helps prevent a range of problems, including night blindness, infections, especially in the throat, chest and abdomen, follicular hyperkeratosis, which can lead to dry, bumpy skin, fertility issues, delayed growth in children. Consuming an adequate amount of vitamin A may have the following benefits. Lower cancer risk. Some experts have looked at whether or not adequate intake of carotenoids can help reduce the risk of lung, prostate, and other types of cancer. However, research has produced mixed results. Healthful skin and hair. Vitamin A is important in the growth of all bodily tissues, including skin and hair. It contributes to the production of sebum, which is the oil that helps maintain levels of moisture in the skin and hair. Food sources. The form of vitamin A will depend on the source. For example, ready-made retinol, which is active form of vitamin A, only comes from animal sources. The richest sources of retinol include organ meats such as liver, fatty fish such as tuna and herring, milk and cheese, eggs. Plant-based foods contain carotenoids, which are antioxidant forms of vitamin A. The body converts these into retinol as it needs. Carotenoids is the orange pigment that contributes to the color of certain fruits and vegetables. Fruit and vegetable sources that are rich in carotenoid are often orange in color. They include pumpkin, carrots, squash, sweet potato, red peppers, cantaloupe, apricots, mango. Plant foods that are rich in beta-carotene includes dark green leafy vegetables such as broccoli, spinach, turnip greens. Recommended intake. The recommended intake of vitamin A varies according to age. People also need more during pregnancy and while breastfeeding. It is available in several forms, and the vitamin A content in food is often measured as retinol activity equivalents, AREs. 1 ARE is equal to 1 microgram of retinol, 12 microgram of beta-carotene from food, 2 microgram of beta-carotene from supplements, 3.33 international units UR of vitamin A. The recommended daily allowance of vitamin A by age are as follows. Up to 6 months, 400 microgram, 7 to 12 months, 500 microgram, 1 to 3 years, 300 microgram, 4 to 8 years, 400 microgram, 9 to 13 years, 600 microgram, 14 years plus, 900 microgram for male and 700 microgram for female. During pregnancy, the requirement is 770 microgram per day, while breastfeeding it is 1,300 microgram per day. The 2007-2008 National Health and Nutritional Examination Survey found that the average US individual aged 2 years and above consumed 607 microgram of vitamin A per day. Who is at risk of deficiency? Those at highest risk of deficiency include preterm infants, infants and children in developing countries, pregnant and lactating people in developing countries, people with cystic fibrosis, people who use the weight loss drug Orlistat may have a higher risk of deficiency. Orlistat reduces the body's ability to absorb fat-soluble vitamins such as vitamin A. Vitamin A supplements are available for those whose bodies have difficulty absorbing the nutrients, but it is best to meet needs through food where possible. This is because the use of supplements can mask possible deficiencies of other nutrients. This may lead to further health issues. Risks. Preformed vitamin A can be toxic when people consume too much, either through their diet or through supplementation. The tolerable upper intake level for vitamin A varies by age. The upper intake level is the amount above which vitamin A intake may be toxic. The following detail the upper intake levels for preformed vitamin A by age. Up to 3 years, 600 microgram per day. 4 to 8 years, 900 microgram per day. 9 to 13 years, 1700 microgram per day. 14 to 18 years, 2800 microgram per day. 19 years and above, 3000 microgram per day. It does not appear that a person can consume too much of beta-carotene, as the body will only convert it into vitamin A as necessary. Vitamin A toxicity. That said, consuming too much preformed vitamin A can lead to vitamin A toxicity or hypervitaminosis A. Symptoms can include changes in skin color, peeling on the palms of the hands and soles of the feet, cracked skin on the fingers, psoriasis, allergic contact dermatitis, ectropion, which affects the skins around the eyes, dry lips, mouth, and nose, which can increase the risk of infection, reduced sebum production. Long-term overuse can lead to changes in bone formation, high cholesterol levels, liver damage, nervous system changes leading to headaches, nausea, and vomiting. During pregnancy, consuming too much retinol can increase the risk of an infant being born with cleft palate, heart problems, microcephaly, hydrocephalus, or water on the brain, problems with the thymus gland, which produces white blood cells. The use of topical treatment retinol may also increase vitamin A levels to an unhealthy level. People tend to use retinol as an anti-aging skin cream. Topical products that have adverse effect on the skin, though this will likely be less severe than those resulting from oral consumption. However, people should avoid using them during pregnancy. The highest risk of overconsumption is with supplements. A healthful, balanced diet is unlikely to lead to a toxic level of vitamin A. It should also provide enough vitamin A without needing supplements. Isotretinoin. Another possible cause of vitamin A toxicity is the use of retinol-based medications. Isotretinoin Accutane is one of such examples. Doctors sometimes prescribe isotretinoin for severe acne. Anyone using this treatment should avoid taking vitamin A supplements because this drug is a vitamin A derivative. A doctor will not prescribe isotretinoin if a person is pregnant or may become pregnant. Summary: vitamin A is an essential nutrient that contributes to many functions in the body, such as protecting eye health. In the US, deficiency is rare. Most people can meet their needs for vitamin A through their diets. In some cases, however, a doctor may recommend supplements. Anyone who uses vitamin A supplements should take care to follow the doctor's instructions, as some form of vitamin A can be toxic in high doses. Hi, thanks for watching to the end. I hope this video has been informative. If you like this video and you'd like to see more content like this, please like, share, and leave a comment in the comment section. And also, kindly subscribe to this channel if you have not subscribed yet. Thanks for watching to the end. Have a nice day and look out for the next video.